Hello and welcome to Ecoholics. Today we'll discuss about the Niti Ayog's report, especially for the health system. So the name of the report is Transforming the Health System. So transforming the health system of India. So this is the topic of today's discussion. Important topic for your examination purpose because Niti Ayog is an important topic and this is a research done by the Niti Ayog. Now largely we can say we have certain schemes like Pradhan Mantri Jan Arogya Yojana, and apart from this we have other schemes for the insurance, health insurance, etc. So what Niti Ayog is saying that according to Niti Ayog, in India, which we are talking about always, that is New India. So that New India by 2022, and this New India at the 75th anniversary of our Independence Day. So we can say that Niti Ayog is saying that in order to believe that a new health system is required, the most important thing is here we need to improve two things. So the number one we have healthcare financing. Healthcare financing. And the second we have is the healthcare delivery. So these are the two things that we need in India. Healthcare financing, if we say, because 64% of our healthcare financing by the households is done by out of the pocket. It means whatever they are thinking, it goes beyond their pocket. Healthcare delivery means that in India 98% of healthcare facilities in India, they employ 10 or fewer persons. It means the healthcare delivery system is not very efficient. It is becoming inefficient. So we need to think and we need to correct these things on the two front. The number one is healthcare financing and the healthcare delivery. So these are the two pillars of the Niti Ayog report. Now we'll discuss and we'll see the data and the reality about the report. Now if you see the government spending, if you see the government spending on the, we can say, on the health is 1.13% of GDP. It means around 2 lakh crore. So if we compare with the overall healthcare spending, so overall spending on healthcare, that is in India, it is around 4% of India's GDP. So here you can see the dismal performance, especially in the health financing, the first pillar that we are discussing. So the overall financing obviously lags the certain things, especially the funds. If you compare with China and other countries like peer groups, India's per capita health spending, per capita health spending. So if you see India's per capita health spending, that is approximately 240, and compare with the China, that is almost, we can say, a third with we compare with the China. And if we compare with Sri Lanka, that is almost half, because in Sri Lanka it is around 490. Now here we need to understand the difference. Even India lagged with the countries like Egypt and Philippines. So here the problem is not with the country's per capita health spending. Here per capita health spending is very less in India. Next thing that we need to discuss is the burden of diseases. Now if you see burden of disease, so this in the examination they may ask about the question of burden of disease measured by DALY, daily. Now this is what we call the disability. So disability adjusted life years. So disability adjusted life years, that is measured per 1 lakh, per 1 lakh population. So if you see that of India, it means the burden of disease in India per lakh people, that stands at 34,000. If we compare with China, it is around 26,000. If we compare with Sri Lanka, it stands around 24,000. So you can see that the disability, if you see the burden of disease in India, is way high in comparison to these two countries. Now here Niti Aayog report is saying that we need certain transition. Now this transition, what does it mean? It means that we should move towards another, we can say, another set of norms. Now in India, previously Indian people were struggling with infectious diseases. Now the problem shifted towards NCDs. What are NCDs? These are non-communicable diseases. Now India must strategize in order to deal with the infection type diseases, but in order to counter non-communicable diseases as well. So we need simultaneous strategy for both these diseases. Now here we can say that the medical care in India must be sustainable, must be on a sustainable basis. Here sustainable means that we need to think not about the, we can say, about the diseases, but about the prevention prior to a particular disease. Like we have to think about the nutritional intervention of the government. Like we need to check the air and the water pollution, because if you see the cities like Delhi and Bengaluru, they are struggling with air and water pollution respectively. So these are the things that we need to take in order to make Indian health system a sustainable system. Apart from this, sanitation and vaccination. Sanitation and vaccination are the two important pillars for their childcare health as well. Now here we can say what government can do. So according to Niti Aayog, government can shift its focus of the households from the out of the pocket expenditure, so out of pocket expenditure, which is called OOP, towards the insurance of health. So this out of the pocket is known as the point of service, and this insurance is known as the risk pooling. It means this will reduce the risk. That is why insurance is simple thing, insuring against any unforeseen circumstances. So these are the risk, that is why name suggested insurance. So point of service, that is what we call the out of the pocket expenditure. Here point of service means whenever you make a payment directly to a healthcare facility, like to the hospital, OPD, operation theatre, etc. Here insurance, the risk pooling means you pay certain premium and you get the benefits of this from the healthcare. Now here we can say we need large pool of healthcare that will reduce the barriers, especially the economic barriers for the individuals, because here the per capita expenditure will go down if you if you pool certain kind of risk. Because whenever a person actually bearing the lot of medical expenses, for that normal person, this high medical expenses pushes him or her towards the poverty. So here, in order to remove this, in order to, we can say, reduce the poverty push of this financial cost of illness, we need certain path, and this path will be provided by the sustainable solution that we are discussing, like prevention, nutrition, checking of air and water pollution, sanitation, vaccination. These are the things will play an important role in the future of the new India. Now, if you see that Niti Aayog has been saying that there is a successful example of Pradhan Mantri Jan Arogya Yojana, and Pradhan Mantri Jan Arogya Yojana is very important to influence the overall health care system. So what is? It is ready to transform the overall healthcare system of our country. Now, this healthcare system that is currently explicitly mandated. Now, what Niti Aayog is saying, that if the government play an equalization role, it is very difficult to do so, because in the absence of certain benefit packages, we can say, which would set the minimum level of services in the government hospitals or etc., which actually country wants, especially in the society, as well as they can afford. So for that we need mandatory, listen carefully, mandatory health insurance. So mandatory health insurance that we need. The best example, if you land in United States of America, even as a tourist, you have to do health insurance. So on the same lines, we can also do this, that we need to provide the health insurance, especially that Niti Aayog is recommending the central government, that government must plan very carefully, and on the basis of this Pradhan Mantri Jan Arogya Yojana, they can build a model for the overall healthcare system for the whole country, and this will benefit the young population as well as demographic dividend of India. Now, according to Niti Aayog report, the employee state insurance that ESI is providing. So here what they are providing, the better access to healthcare beneficiary services, these are not up to the mark, and they are charging the huge amount of money, especially they erode the in-hand salaries, because in order to contribute this ESI, companies are taking money from the employees' pocket. So these are the important points that I would like to I was able to discuss with you. But here, if we compare with the other countries data, so we'll see in a slide here, we can say the total healthcare. So the total healthcare expenditure as the percentage of the GDP. Now, if we compare with India, China, Sri Lanka, Indonesia, Egypt and Philippines. Now, India's total health means government plus other private as well. So it is 4%. Compare with China, it is 5.5%. If we compare with Sri Lanka, it is 4%. Compare with Indonesia, which is 3%. In Egypt, 5%, and Philippines, it is 4%. What Niti Aayog actually quoted in their report. Now, if you see the per capita health expenditure in India, which is quite low, around 240. In China, which is way high, 3 times more than India. In Sri Lanka, it is also high in comparison to India. In Indonesia, it is also high. In Egypt, it is also high, and in Philippines, it is way high in comparison to India. Now, if you see the out of the pocket expenditure in India, which is very high, so 64%, it means total health expenditure, if you are spending 100 rupees, then out of the pocket expenses are 64% of that. If we compare with China, it is around 36%. In Sri Lanka, it is 50%. In Indonesia, it is 60%. In Egypt, it is 62%. And in Philippines, it is 54%. Now, if you see the global healthcare rank which Niti Aayog actually quoted. India's global healthcare rank is 145. China's is 92. Sri Lanka's is 71. Indonesia's is 138. Egypt is 111, and at last Philippines is 124. So these are the data that is important in order to compare the countries in the Niti Aayog survey report. This will actually, whatever I've suggested in this lecture, if you provide the consolidated health services in the ecosystem, that will lower the cost and make digital analysis of the health very easier. Now risk pooling is obviously an important tool. So from the out of the pocket expenditure to the pooling of risk. So that is from directly paying to the healthcare facility towards the insurance. This is a journey that India has to make. So that's the end of this lecture. If you have any query, any doubt, anything you want to ask, you can ask. So today is Saturday, it means we are not meeting tomorrow. So at 10:30 p.m. from Monday to Saturday, we're meeting on a daily basis for the current economic discussion and analysis. So for current economic discussion and analysis, we are meeting daily, and these kind of discussion we take one important economic topic and we discuss on a daily basis. Apart from this, these kind of discussions are helpful for UPSC examination, especially for civil services examination in both the preliminary as well as the mains examination, as well as the economics optional student can also get the benefit from this. Indian economic services students also get the benefit from this kind of discussion. They'll get the content in order to write the answers into the examination. Apart from this, for the RBI phase 2, we can say for the banking examination, especially in SO and PO, you'll get the questions of the essay type. Apart from this, we are having the lot of courses on our mobile app, and for that you can visit our website ecoholics.in for more information, and you can download our app, that is the link given in the description of this live session video. So you can see that economics optional we have just started. For the Indian economic services, we are starting from the 5th of December, and apart from this, other courses are also available. So for more information, you can visit our website or you can call on this number. You can follow us on Instagram account where we provide daily questions, as well as on our YouTube channel. So if you subscribe, you'll get the daily question in the community tab. So till then, thank you so much. Thank you for subscribing Ecoholics, and please like, share and subscribe Ecoholics. So till then, thank you so much. Good night.